All right, so there are some couple of principles guiding taking of medical history. So, taking of medical history, first of all, trying to introduce it, although everybody here should know it, it's just some couple of questions that you're asking the patient. So, the patient came to the clinic, you're asking the patient some couple of questions because from the questions you want to kind of like pick up some one or two things. In fact, it's the questions and the answer that the patient is giving you. This is what will help you to be able to know what is wrong with the patient. Do you understand? But there's a rule, all right? And this rule is more of like, in as much as you are interacting with the patient, do not allow the patient to take over. Yes, you are supposed to interact with the patient, but don't allow them take over the whole gist that you guys are doing. All right, be in control. Make sure that everything the patient is telling you is controlled by you, is what you want. Let them not divert from what you want. Yeah, they could divert, but not for too long. You understand? So what we have here is this. First of all, if you are in control of a medical history, that means you are the one pushing out the questions. You are the one getting what you want. It will help you. You understand? For you to, it's essential for accurate, efficient, and clinical relevant. Can you see the relevant there? So you are getting information, and this information is just what you need. All right. So some strategies that will help you to stay in charge when taking history include things like what? Set the tone clearly. So begin with a clear introduction and explain the structure of the consultation. Yes, you tell the patient why we are here. All right. So for example, I'll ask you a few questions just to understand your health better. Yes, you tell the patient why you guys are there. So use focus and closed-end questions. Start with yes or no or short answer questions to guide the conversations. Like the questions you're asking the patient, it will force the patient to be giving you the answers you need. Do you understand? So asking clear questions will help to what? Avoid all those long tangential stories that scatter from what is supposed to be there. Redirect gently but firmly. So let me say if there's an issue and you are trying to kind of like push it, and there's kind of like a deviation from what you want, you can redirect the patient. Right? Summarize and transition. So periodically summarize what's been said to show you are listening. That's like over time you can just tell the patient what you have understood so far from the conversation. This will make the patient know that you are listening, and to make them want to talk more to you. Okay, use time management cues. So if you are saying this is 10 minutes conversation, make sure that it's within that 10 minutes, because of course most of the times in a hospital settings you are attending to this patient and are waiting for the next one to kind of like come through. Maintain professional boundaries. Okay, so why it matters, it ensures that the relevant talk was said there. It prevents missed diagnosis, right? No funny jokes too much, all right? It builds trust, respectful communication. So the patient will this guy, what he wants is just this one, all right? So that's just it for this rule in history taking.